What is TriLift?
TriLift is a combination of couple technologies actually. It contains muscle stimulation technology, something similar with electricity stimulation, but more advanced and that works better combined with radio frequency. Also on the device we have a microneedling RF, which is known to be the tiniest little needles on the market. So with these tiny little needles, we can work very close to the eyes, which helps a lot for people with saggy skin around the eyes. And of course, the best and like more advanced technology in TriLift is the fact that it can work on a gland around the eye, which does help a lot of people with dry eye syndrome and also people with a saggy bags under the eyes.
Does the treatment hurt?
It doesn't hurt. It's not very comfortable because of electrostimulation. So it's not like you're getting a massage, obviously. It's not painful at all. It's a combination of radio frequency, which gives you a nice warm, and electrostimulation. So anybody who is not very sensitive to electricity, like people with a pacemaker, for example, cannot do it. But for anybody else, it's like doing a very, very slight, tiny massage on the face.
Is there any downtime?
So there's absolutely no downtime. For some people who does microneedling RF on the device, you can have a slight redness, but which goes away within maybe a couple of hours. People who do just dry treatment or facelift, there is absolutely no downtime. So it's a lunch-hour procedure, and it gives an immediate effect.
Can it only be done on the face?
No, actually, TriLift can also be done on the body. So, like for stubborn areas on the body, let's say stomach or arms or butt lift, we can also do it there.
What is the protocol?
So the protocol is very easy. You have to come 5 times once a week because the way it works, we stimulate the muscle on the face. So just to give you a little bit of idea, this is the young face and this is how we age. So with law of gravity, everything starts to go down. So we have a deep lying fat parts on the face, and when muscles get loose, everything gets loose. It starts to go down, and that's how we age. So what TriLift does, it brings the muscles back up where it's supposed to be. So what it does, it keeps it there. It's like doing a gym. Like you go to gym, you exercise, you keep your muscle tight. It's exactly the same thing. You're keeping your muscle tight on your face. So that's what it does. And that's how you basically don't age. So you do 5 treatments once a week, and then you're good to go for 6 months. You come back every 6 months and you maintain it with one treatment only, and basically you have your muscle where it's supposed to be, and it prevents aging, and of course it prevents the future surgeries and injectables. I hate to say that, but it does. And the only properly the only thing you might need to do maybe later on is to treat your skin, which we have other devices for that.
So is it good to be treated with other treatments as well?
Of course, like it depends. Like let's say try it, as we said, it's good for muscle stimulation. So it stimulates the muscle, it keeps it where it's supposed to be, but it doesn't. It also helps radio frequency helps to smooth the skin. But of course, people who have acne, open pores, scars, other concerns, then we do other treatments for that. But for facelift, I think it's the best. What also it does, it brings up, a lot of people have problem with the eyes. So as I said, it's the only device which can treat. It's been actually indicated by FDA in Health Canada to treat the dry eye syndromes, and it treats the gland around the eyes. But it also helps people who have a lot of bags under eye, and it treats the muscles. There is a muscle on the forehead. Yes, we do the Botox, but the muscle itself goes down, and that creates a lot of skin on top of the eye. So what it does, it lifts back the muscle and opens up the eyes. So it's a great treatment for that as well.
Who's a good candidate for TriLift?
Well, anybody can be a good candidate. It's a preventative treatment, so I would say anyone after the age of 30 should be doing it. So this way they never age. Of course, younger you start, better it is because it's always better to prevent than correct. So the best way to do it is when you're young, before you actually lost your muscles. And it's the same thing as going to gym. Exactly the same analogy. Like you're gonna go to gym when you're young, right? So you're not gonna wait until you're old and then you can move. So it's the same thing. You keep your muscles strong and then you don't age.